Good morning. Calling to order the Board of Health meeting for today is February 28th, 2025. The minutes of the last meeting on January 29, 2025 were circulated. Are there any amendments, Ms. Walker?
No amendments. No.
Okay. I'll take a motion to approve it. Ms. Walker?
I will second that motion.
Okay. All right. So Ms. Walker votes.
Votes aye.
Abraham votes aye. The minutes are unanimously approved. Ms. Rosacci, our third board member, could not join us today. I'd like to recognize Ms. Catherine Rajwani, who would like to be heard. Thank you, Ms. Rajwani, for being here this morning. We'll give you 5 minutes to share what you'd like to share with the board.
Okay, thank you.
Thank you.
Good morning.
Good morning.
My name is Catherine Rajwani. I live in Shrewsbury, and I'm here to discuss Shrewsbury's practice of adding fluoride to our town's drinking water. Adding artificial fluoride to Shrewsbury's water is a local decision. Neither the federal, state government, nor its agencies mandate its addition to our water supply. The Board of Selectmen, acting as our town's water commissioners, are responsible for the decision to add fluoride to our water supply. The Board of Selectmen has consistently turned to this board for guidance as to health concerns associated with our residents' consumption of fluoride. As far as I know, adding fluoride to our town's water supply is the only medical intervention affecting all Shrewsbury residents. Most residents are unaware of this intervention, therefore they do not provide their informed consent. There is no regulated or appropriate dosage of fluoride for our residents. The same level of fluoride is provided for a baby that is provided for a 200-pound man. There is no upper limit or cutoff of the total amount of fluoride our residents are consuming, which accumulates in their bodies. Some residents may follow guidelines for recommended water intake per day. Some may drink more and others little to none. Many foods and beverages also contain fluoride. Your endorsement of adding fluoride to our water subjects our water department employees to health and safety concerns through their handling of a highly dangerous and toxic chemical. Approximately 99% of fluoride additives go directly into our wastewater, where they harm plants and animals and contaminate groundwater. There has been no monitoring by this board of total fluoride exposure of our residents from all sources, including topical dental applications. The purported rationale of water fluoridation is the reduction of cavities. Large-scale studies from the US and the UK have found little practical or statistical difference in tooth decay rates among children living in fluoridated versus non-fluoridated areas. There is a significant history of Shrewsbury's residents voicing their concerns with our community's water fluoridation. In 2015, a citizen's petition was brought to town meeting requesting a cessation of artificial water fluoridation for all the reasons I just stated, and citing studies showing that fluoride acts as a neurotoxin in developing brains and an endocrine disruptor. Rather than pause and investigate all the problems with fluoride, this board overwhelmingly supported water fluoridation. Citizens' petitions to end fluoridation were also brought in 2016, 2018, and 2021. This board heard from citizens who could not drink our water due to their medical conditions and were trying to sound the alarms to protect our vulnerable populations. Many email requests were submitted to this board asking that they warn pregnant women about the dangers to their fetuses' developing brains caused by drinking Shrewsbury's fluoridated water. This board refused to issue these warnings, indicating fluoride consumption was safe for this population. When asked for safety studies, this board relied upon in justifying these opinions. This board refused to provide any. In response to each citizen petition, letter, and email request, this board unanimously and vigorously defended adding fluoride to our water, even in the face of an ever-increasing number of studies evidencing fluoride's harm as a neurotoxin, endocrine disruptor, enzyme inhibitor, and inflammatory agent. Rather than do no harm, this board has been a consistent advocate for the addition of artificial fluoride to our town's water. I assume your position has not changed. When I asked to discuss fluoridation months ago, I was informed that fluoridation is not a topic of discussion for the Board of Health at this time. I suggest that you revisit your position on our community's water fluoridation. The tide is finally turning on this issue, as it eventually did with tobacco, asbestos, DDT, and lead. This board should be aware of the federal lawsuit against the EPA in California concerning community water fluoridation that determined in September of last year, and I quote, "Fluoridation of water at 0.7 milligrams per liter poses an unreasonable risk of reduced IQ in children. The qualitative evidence is superior. The size of the affected population is vast." I assume the board has educated itself as to the systematic review by the Cochrane Collaborative last year entitled Water Fluoridation for the Prevention of Cavities, reiterating that early life exposure to optimally fluoridated water causes harm to teeth in the form of dental fluorosis, and that the very small reduction in cavities, a small fraction of a single cavity, they found from poor quality studies may not be real, which was consistent with other large 21st century reviews. I hope that the board noticed that this month, Utah banned community water fluoridation. The board should also be familiar with the Surgeon General of Florida calling fluoridation public health malpractice, and issuance of an advisory to the Florida water treatment plants to end community water fluoridation schemes based on the evidence of neuropsychiatric harm. The same advice has been advocated by our current U.S. Secretary of U.S. Secretary of Health and Human Services. Every email sent to this board, every presentation made, every study provided, and every concern voiced over the past 10 years has been cataloged on Sustainable Shrewsbury's website, and as has your board's zealous endorsement of this medical intervention and votes against supporting our citizens' petitions. The tide is finally turning in the minds of citizens and in our government concerning the plethora of harm that fluoride in our water is wreaking upon our bodies. This board's significant and meticulously documented history of assurances of fluoride's safety and efficacy may subject our town and all those involved with these representations and decisions to significant liability, which will have downstream effects on our tax rates and municipal budgets. Right now, we have 1 in 6 children in the U.S. with neurodevelopmental brain disease, including ADHD, autism spectrum disorders, low IQ, and behavioral disorders, and 1 in 8 women who will develop thyroid disease. These 2 epidemics tell us that fluoride has no place in our public water. I suggest that this board, after 10 years, finally make fluoride a topic of discussion, warn pregnant residents of the harms to the developing brains of their babies, ask that the Board of Selectmen, acting as our water commissioners, at least pause fluoridation while the town educates itself on the extreme hazards of community water fluoridation. You should also hold a public forum or hearing concerning fluoridation. Many people in our community cannot drink our water. You should hear from the residents about their experiences and concerns. Thank you.
Thank you, Ms. Rajwan.
Thank you.
Okay, we'll now move on to our next agenda item, which is the review of the communicable disease update. Ms. Horton.
Good morning, everyone, to the chair, to the board. My name is Amelia Houghton. I'm a public health nurse for Worcester and the Alliance Towns. I'm just going to give a quick communicable/infectious disease update for the month of January. As you know, this is respiratory season and the cases are elevated compared to other seasons. We did see a slight uptick in COVID cases in January versus December, not by much. And again, this is reported cases. The wastewater summary shows that the numbers are increasing at the moment. And in terms of flu has also increased from December to January by at least over 100 cases that were reported. We had no reports of pertussis and no reports of measles and no outbreaks. Currently, locally and nationally, we are still dealing with bird flu, norovirus, and measles, and these three conditions continue to draw attention. I'm just going to give you, I know we've discussed bird flu before and norovirus, but just going to give you a little bit more of a background. As per an interview with Dr. Catherine Brown, Massachusetts state epidemiologist. So she says that bird flu is widespread in wild waterfowl. So wild ducks and geese are actually the original reservoir for this species, for these viruses. So even though there have only been 67 reported human cases, and with the virus we're seeing being in wild birds, the risk to humans in Massachusetts is still low. So we've not had any cases. We report no human cases to date. And at this point, the virus has only spread from animals to humans. And obviously, a big precaution is to avoid unpasteurized raw milk and undercooked meats, and poultry and beef as well. So for norovirus, we discussed last time, what's important to keep in mind is don't eat perishable food that has been left out for more than 2 hours. Be sure to wash your vegetables and fruits. Keep them separated from raw meat. Keep in mind, hand sanitizer does not work with norovirus. You need alcohol. You can't have alcohol. You have to use bleach to kill it. And what is currently affecting, excuse me, the nation as well, is measles. So measles is airborne, and it is extremely infectious, and there's the potential to have a severe rash from it. It's not a seasonal virus, but usually we see it spread over times of travel, and spring break this time of year, you're going to see some of it. Or in situations where there are persons who are unvaccinated in close quarters. So to date, in the US, we've had 93 cases compared to all of last year, which was 285 cases. So the thing with measles is it's highly contagious, and it can live up to 2 hours in an airspace after an infected person leaves an area. And so the droplets can land on surfaces and spread to other people if they touch an infected area and then their mouth and their nose and their eyes. And this is per the CDC. So sharing, shaking hands, holding hands, hugging someone with measles, pregnant women with measles can give it to their babies either during pregnancy or while nursing. So it is very important to protect yourself against measles and talk to your provider about your vaccination status. Because even though the MMR vaccine is given to children under a certain age, adults can still receive it. And if they've received a dose, they can still have their blood titered for immunity, and then obviously they can get the vaccine if needed at that point. But that all needs to be discussed with your healthcare provider. That's really it for the communicable diseases, unless anybody has any questions.
Yeah, any questions for Ms. Houghton?
No questions. Thank you for your update.
Great, thank you for the update. We'll now have a tobacco presentation from Mr. Kyle O'Connor.
Good morning, Chair. Good morning, Board of Health.
Morning.
My name is Kyle. I'm here to present on the tobacco regulations for the town of Shrewsbury, and as well as update you on any retail education visits that I have done this week. I'll just share my screen. Can everyone see everything okay?
Not right now.
Here
Yep,
it is.
There
Yep.
we go. You may want to just change that to the presentation mode.
On my screen, it is in presentation mode. Is it not showing
So-
that for you all?
Yeah, so you may want to go to the top of your screen and where it says swap presenter mode, you need to click on that because we're seeing the preview mode. That's in Zoom, so when you go to the top of the screen, you'll see the drop down from Zoom. There's an option to switch display.
Okay, let me try that.
So you may first need to put your PowerPoint into slide presentation mode.
Okay. Sorry, every time I put it in presentation mode, it doesn't allow me to view
Okay.
anything besides the
No
presentation.
sweat, just continue, don't
Okay.
worry. Yeah,
All right. So I'm here to review the regulations for the town of Shrewsbury, as well as go over some local and state regulations and discuss some compliance efforts in retail education I did for the town of Shrewsbury. So a little bit about your permitting regulations. So there are 20 tobacco permits allowed in the town of Shrewsbury. You are currently at your cap of 20 permits, so no additional licenses for tobacco retailers are available at this time. Tobacco sales permits are non-transferable. If there was an owner to sell their business, the new owner must apply for a new permit. No permits shall be issued within 500 feet of a school, and smoking bars are prohibited in the town of Shrewsbury, so no permits for smoking bars are issued. About your permit renewals, permit issuing and renewals
Excuse
is the
me, Kyle?
responsibility. Sorry, go ahead.
We're still seeing the overview, like your first slide.
There we go.
Yeah, there we go. Okay, cool.
All right, I'll just present like this so we can all see.
Okay, thank you so much.
sure, that's fine.
All right, so permit renewing is the responsibility of your town public health department assistant, which is Carrie, who does a great job of tracking all these permits and making sure they're all paid on time. If there was a permit open, they would go on to OpenGov, which is your electronic permitting portal, to apply, renew, and pay their permit fees. If a retailer were to sell to a minor within 3 times within a previous year, their permit will not be renewed and be returned to the board. Now going into product and sales restrictions. Flavored products are prohibited in the town of Shrewsbury per your regulations, which aligns with the state law, as well as any tobacco product flavor enhancers. And those are mostly rolling papers and anything that can enhance the tobacco product. Blunt wraps are prohibited. Non-residential or your own machines are prohibited. Self-service displays and vending machines are prohibited. And tobacco sales are prohibited in the education and healthcare institutions in the town of Shrewsbury. Now going on to electronic nicotine devices and cigar pricing. So electronic nicotine devices or vapes must not exceed 35 milligrams per milliliter. That equals out to 3.5% nicotine. So that bans any 5% nicotine vapes that are out there. This does not apply to adult-only retail tobacco stores where they're allowed to sell over that limit. Minimum cigar pricing in the town of Shrewsbury for a single cigar must be $2.50 or more. For a 2-pack or more, it has to be at least $5 or more. A little bit about my compliance and enforcement. So my goal is to visit each retailer in the town of Shrewsbury at least 3 times per year. That includes an educational visit, a compliance check with a youth, and then an enforcement visit. And any additional visits may occur based on any complaints or violations that we see. And some common violations that I see are selling to minors, selling flavored tobacco products, incorrect signage, or incorrect minimum cigar pricing. The last 2 don't always result in a citation, as those are easy fixes, and my goal for all retailers is to get in compliance and not just to find them. So when I do see those things during my educational visits, if they can be solved right away, That's that. And the next time I would go in, that would be a violation if they did not fix the things that I noted. And this is just the fine and penalty structure for the state level as well for the local level. The state level are more steep, and that involves selling to minors or selling flavored products. And just an update on the retail education visits that I finished this week. So there are 20 retailers in the town of Shrewsbury. One was conducted in November as there was a new owner who required education. And the other 19 stores were inspected and given tobacco education in the month of February. I noted that only 2 retailers were given educational warnings for incorrect cigar pricing, which they then fixed during the visit. And each retailer was given a copy of the state and local Shrewsbury tobacco regulations, a brief overview of those regulations, my contact information, and any additional signage that they needed. And these are just some emerging trends that I'm noticing. There's an increase in youth vaping and disposable vapes. Popular brands include Elk Bar, Crave, and Flume. There's an increase in youth oral nicotine pouches like Zyn. There are online sales and social media marketing campaigns that make this enforcement slightly difficult. And there are potential policy enhancements to address new products and enforcement gaps. And if the board or the chair has any questions for me at this time, feel free to let me know if you have any feedback on the education visits, policy recommendations, or education initiatives.
Thank you. So based on your review of all the retailers that you visited, you have seen no compliance violations?
Nope, the only 2 that I witnessed were incorrect cigar pricing, which they promised to fix during the inspection. So the next time I would do my compliance checks, I would just check on those things and make sure that they address the issues.
Got it. Other question?
I'm just
And I will
curious.
share this presentation with Carrie, who can share it with you as well.
Great, thank you.
And another question is, how can, citizens file complaints? What is the process for that, and how are individuals educated about that process?
So if an individual were to go into a retail location and they saw something that they wanted us to know, like if they saw flavored products, they could reach out to myself or Carrie, who would then coordinate with me, and then I would go conduct a compliance check at that location. So I'd probably be best reaching out to Carrie first, and that way she can connect me to the issue, and then we can go from there.
Awesome. Thank you.
Great, thank you very much. All right. The environmental health data was there in our packets. If there are any questions, and did you want to comment on anything in particular? Or?
Just wanted to discuss a few updates.
Please.
So one of the emergencies that occurred was at 14 and 16 Maple Avenue, which also involves a pizza establishment. The permit was suspended at the moment because at the time because the gas and electricity was shut off at the property. Currently, the rental property now, the rental property at that time had been condemned, and the occupants were relocated on February 18th. The property has now been released from condemnation, and it's okay for the occupants to go back into the units to occupy them again. At the moment, the owner is traveling abroad and does not plan on resuming business at the pizza restaurant at the time, but he will call for an inspection when he's ready to open the restaurant again. There was also a complaint at one of the grocery stores in town about the smell of deceased rodents. This has been an ongoing complaint for the past few months. The inspector, Emma Stefanski, conducted a routine inspection with the person in charge. At the time of inspection, there was no rodent activity observed. Pest control occurs 3 times a week at the establishment, but the person in charge explained that there were issues with a seal around the interior grease trap, and that was causing the odor, and they are working to address the problem. There was also a complaint of cross-contamination at another food establishment in town. And there were allergen concerns because staffers were not wearing gloves or hairnets. The possible cross-contamination observed was when applying hot pepper spread over mayonnaise. The other parts of the complaint were unfounded. The advice from the inspector to the person charged was to wipe between uses of applying the hot pepper spread and mayonnaise to avoid cross-contamination. And there was also discussion about proper storage of wiping cloths when not in use. Another update I just wanted to discuss was we also received a complaint about a package store in town. There was concerns about rodent activity again, and this was on the 27th of February. I conducted an exterior inspection of the establishment. I checked for any type, rodent activity, if there were any nesting, anything going on. At the time of inspection, there were no visible signs of any rodent activity, no gnaw marks on the building, no nesting, no shredded paper or fabrics were present. I also checked for potential entry points. I checked the doors, exposed pipes, door sills. I found everything to be adequately sealed with no signs of rodent access. I also entered the establishment and spoke with the person in charge, explaining the complaint. The person in charge assisted me with the interior inspection. Part of the complaint was that some of the prepackaged food items had holes and gnaw marks from possible rodents. We inspected all the chips, all the chocolate, all the candy. At the time of inspection, found no
Evidence?
no evidence. I
There you go.
apologize. We found no evidence at the time. And we also did a walkthrough through the rest of the establishment. And again, we found no evidence, but however, I did recommend to the person in charge to maintain our regular preventive measures to ensure that there be continued rodent-free conditions. Besides that, that's all I have to report. If there are any questions from the board.
No questions, thank you.
Yeah, thank you. Thank you. Our next meeting is scheduled, Carrie, for March 19th. Thank you, Ms. Walker, for your flexibility. And, right, seeing no other business, we will move to adjourn.
Excuse me, before you do that, I just wanted to see, did you have any questions for me? I noticed on the agenda, it said that there was gonna be a discussion about community water fluoridation.
No,
So-
the discussion was your request to be heard. We heard you. That's it.
Oh, so no questions, no
Correct.
discussion, no
Correct.
response?
That is correct.
Oh, okay.
Yeah. We're not here to debate. This is not a public hearing, so the meeting ends at this point.
Will you have a public hearing on fluoride if we?
Oh, that's something that the board will decide about.
Okay,
I
thank
can't comment on that right now.
you. That would be great. I think we should do that.
Great, so motion to adjourn.
Motion to adjourn.
All right, Ms. Walker.
Those aye.
Abraham, aye. The meeting is adjourned.